My name is Anna Wald, and I'm a professor of medicine, epidemiology, and laboratory medicine at the University of Washington, and the director of the Virology Research Clinic. So these are the first studies for the novel H1N1 influenza, so-called swine flu, studies that are done at the University of Washington, and we've enrolled about 120 patients. The duration of the study depends on the protocol. So, for example, in this first one, we're only following people for about 2 months. In the next one, we'll follow people up to 6 months. There are people who are basically healthy, who don't have any immunosuppression, and who are free currently of any major medical conditions.
Hi, my name's Eduardo Munoz. I'm a clinician also here at Harborview Medical Center. I work next door. Then I saw this ad say so. Swine flu vaccine will study. They were needing people. And I got involved in the study because one of the clinicians here, so I asked him about it and about the safety about it. And he explained to me some. So I said, hey, it's a safe vaccine. Why not get ahead of the pack? You know, I flew to Thailand with my girlfriend last July, and everybody there was wearing masks. And I told people also in our clinic to go ahead and do it. They asked me a lot of questions, and some of them did. A lot of them were skeptical. But when they found out I didn't have any side effects, they all registered after I got the first shot. I got my first shot. I got 2 shots of the vaccine. And then I got 3 blood draws, so I would say that's 5 visits, 2 phone calls, and then my last interview visit will be in the next week or so. So I would say 6 total. We're talking about 20 minutes or less. First one was the only one that was longer because they have to ask a lot of questions if I qualify or not. After the shot, there's a mild discomfort like any vaccine for a couple of days or less. And pretty much that's it. No headache, no fever, nothing. The first shot, the next day, I felt slight, like a little rundown, but that was just for like 4 or 5 hours. After that, I'm back to normal again. The second shot, none at all. Maybe one day it's slightly sore on the side of the shot, but otherwise it was fine.
There's no possibility of developing H1N1 from the vaccine. Only a component of the virus is used. It's not a live virus vaccine. It's an inactivated vaccine. The second study will be starting towards the end of September, and that study is looking at a different vaccine with what's called an adjuvant. An adjuvant is a substance added to vaccines to make the body respond with a better immune response. And the reason it's especially important for this study is because we don't think there's going to be enough vaccine for everybody. So if we can use a smaller dose of the vaccine and combine it with the adjuvant, it'll stretch further. So it's going to be this next tier of studies that are going to be able to define whether or not we can do that and still protect people. If people are interested, we ask them to call our clinic. First, we discuss it with them on the phone. And if they sound like they're healthy enough and they're interested, we ask them to come in. And once they come in, over 90% people are found to be eligible to participate in this study. A few are turned away. It's mostly done for their safety. The protocol excludes people who might be at increased risk for adverse events after the vaccine.